In a bid to fight against the pandemic, the Indian government has now cleared 2 more vaccines and 1 antiviral pill or drug for emergency use. The 2 latest vaccines that have been given a green signal are the Serum Institute of India's Covovax and the biological jab known as Corbevax. Apart from this, the anti-COVID pill known as molnupiravir has also been approved for restricted use only in emergency cases. Taking to Twitter, India's Union Health Minister Mansukh Mandavia said that the step has been taken to strengthen the country's fight against the pandemic. And the 3 approvals of the vaccine as well as the antiviral drug will boost India's fight against the pandemic. The minister further added that the Corbevax, which is India's first homegrown RBD protein subunit vaccine, now happens to be the 3rd vaccine to be developed in the country. The other 2 vaccines that have been made in India are Bharat Biotech's Covaxin, which has, of course, been a crucial aspect of India's vaccination drive, and the Serum Institute of India's Covishield, another vaccine that India has deployed in its ambitious vaccination program. Now, the announcement that comes a day after an expert panel of the country's Central Drug Authority recommended granting emergency use authorization to Covovax and Corbevax, however, only with certain conditions. The committee also approved granting restricted emergency use approval to the drug, that is molnupiravir, for treatment of adult patients with COVID-19 and those who have high chances of progression of the disease or symptoms. With the latest approvals, a total of 8 COVID-19 vaccines have now received emergency use authorization from India's drug regulator. Meanwhile, with India's national capital, New Delhi's positivity rate now remaining above the 0.5% mark for the 2nd consecutive day, the government has issued a yellow alert, which means that under this alert, activities that were earlier resumed in phases during the 2nd wave of the pandemic will come to a grinding halt. For a better understanding about India's fight against the pandemic, joining us now is our principal diplomatic correspondent, Siddhant Sibal. Siddhant, thanks for joining us. Now, 2 more vaccine and even an antiviral drug for emergency use, which has now been cleared by the Indian government to fight the surge in cases, specifically Omicron cases. And this is happening at a time when cases are also surging in the Indian capital, New Delhi. What can you tell us about this?
Well, yes, there is an increased worry about the Omicron variant of the COVID virus, and we know that cases have been coming, especially here in the national capital, Delhi, and in the state of Maharashtra. Now, we know that earlier today, the Delhi government announced yellow alert. Delhi has a system to deal with the surging numbers. This is called the GRAP system, which is Graded Response Action Plan. And under this, the first level has been breached because of 2 consecutive positivity rate of over 0.5%, and under the yellow level, which has been breached, non-essential activities have been closed with immediate effect, which means gyms, places like the auditoriums will be closed. Also, when it comes to restaurants, 50% of the strength can only be allowed. Same stands true for metro. Also, we know schools have been closed, colleges have been closed. Very few places are open. In fact, private offices, 50% of strength can be allowed only. And there is, of course, the curfew, which comes into effect from 10 p.m. to 5 a.m. So if the numbers continue to increase, then it will go to the amber alert, then orange and red alert. And under the red alert, it is a complete lockdown. It's a closure. So to deal with the situation, while this has been announced, we know that the government, the central government has, as you pointed out, has given approvals and focuses on vaccination. Next week, we'll see vaccination for the adolescent group and, of course, precautionary dose also being given.
Right, absolutely. Now, Siddhant, this announcement, of course, comes at the time and, in fact, on the heels of India expanding its vaccination program to include booster jabs for frontline workers and 60 years plus citizens with underlying health issues. How will all this pan out in the new year, with multiple states now introducing new curbs at a time when people are hoping to celebrate travel as the year wraps up?
Well, it looks like it's a deja vu moment, for, of course, given the fact that we have seen this happening in the past as well. But India, of course, does not want to deal with another April, which happened, in which we saw the cases surging, the second wave of the devastating COVID crisis earlier this year. So to deal with that, there is a two-pronged strategy which is underway. One, of course, is through restrictive measures, non-essential activities being closed, whether it's here in Delhi or other states, and of course increasing the vaccination. The adolescent group will be getting the vaccination. It will start from Monday, from 3rd of January, and of course the healthcare workers, the frontline workers, they will be also given precautionary jabs. In fact, people above 60 will be given jabs as well, precautionary jabs as well, but they need to get a prescription from their doctor. So that is the focus in the new year. So of course, there is a sense of fatigue, but also the government is making sure that there is no repetition of what we saw earlier this year.
Absolutely, and that's the hope for all of us as of now. Thank you, our principal diplomatic correspondent Siddhant Sipal, joining us from New Delhi. Thanks for all those inputs. WION World is now available in your country. Download the app now and get all the news updates on the move.